There are three basic aspects actually of palliative care or early palliative care. The first is to identify people early, then to assess them in a holistic fashion, and then to plan. So to identify people, it's best to be done early at diagnosis of a life-threatening illness. So while they're still possibly curable, if there's a risk that they might die, it's good to start this approach. The WHO, in fact, has resolved that this should be done by all member countries, and so for the last 2 years, countries are setting out to do that. Early integration of palliative care. They also say this should be done specifically in the community to promote access to such care. This early palliative care is even earlier than in the Tamil studies, where people with advanced lung cancer have been recruited at that stage. This is even earlier than that. The second key point is assessment. So someone who gets cancer may have various issues. There may be physical problems, psychological, social or existential areas. And so it's good to work out actually what's the main issue with them. As doctors, we do tend to look at physical issues, but it may be a social problem. I had a patient once who said, I want to get married, I want to get right. Or it could be anxiety. I myself got lung cancer 2 years ago, and I worried a bit about it. I'm better now, but at that point in time, just to talk a bit about it is useful. We don't have to say that is palliative care, but just acknowledging that there may be an aspect in that area that an oncologist might say, hey, this must be tough, for instance. So that's identification, assessment and planning. So it's a really key in survivorship planning or care planning or palliative care to make a plan together with the person. To talk to them, okay, what do you want to do? Being patient-centered, what are your goals? What are your needs and goals? A good question might be, what do you want to do that you can't do? So basically, good care, palliative care, good palliative oncology, call it what you want. I was at talk today talking about it was a psychosocial oncology. We don't have to have a word for it. It's just listening to someone and being supportive. Yes, some people can deny, or if you go to them and says, how are you today? They say, I'm fine. They maybe don't want to talk about there. But I think people deserve to have the opportunity to give another narrative, because everyone has got a public account. I'm going to get better. If you bop up to them, I'm so fine. But if you say, hey, are there ever days when you don't feel quite so well? A lot of people will say, well, funny you say that. Sometimes I think most people, our research has shown, actually have this realistic narrative, it's called, rather than the public account. And allowing people to express that is very helpful for them. And then you can go forward and look at these worries and maybe address them.